My name is Anuradha. This whole incident is about my father, who's 92 years old. His name is Jagannathan. Unfortunately, about 6 months ago, he had a fall and ended up fracturing his hip. We had actually already consulted Dr. Kumar Dev from Manipal Whitefield on previous incidents for my father. So immediately we took him there. We wanted Dr. Kumar Dev to see my father.
It's been estimated that post 65 years of age, 1 in 3 women and 1 in 12 men could sustain a hip fracture in their lifespan.
Here is an inspiring story of a nonagenarian aged 92 who braved the injury and with his sheer determination and mental strength was able to regain his ability to walk and be independent.
Dr. Kumar Dev, as usual, was very upfront with the whole procedure, all the process which would be involved in his recovery. He, after looking at the X-ray, he strongly felt that the best option would be to do full hip surgery with the pin and the screw and stuff, because he felt otherwise my father would be in a lot of pain and his quality of life would be severely affected. We were a little hesitant because of his age, but both my sister and I were very confident that my father would handle it very well. He is an extremely positive person, very optimistic. He never pulls himself down. So we were confident that he would come out of it well.
Geriatric hip fractures, which we address routinely in our trauma practice, is associated with significant mortality and morbidity such as DVT, secondary infections, bed sores, cardiopulmonary events, loss of mobility, loss of independence, all of which in turn causes physical and emotional hardships for the family.
We had full confidence in the team because, like I said, we had interacted with Dr. Kumar Dev before. And within 2 days, the physiotherapy team, in fact, his main physiotherapist was a young woman called Anaga, who was just simply wonderful with him, really made him comfortable, made him understand the exercises he needed to do.
Apart from the surgical expertise and optimal fixation of fractures, recovery from such injuries depends a lot on the mental and physical strength of the patients and how active and independent they were prior to the injury.
We needed to do a lot of changes because just for him to understand his new lifestyle that he couldn't walk normally, it all took time. But my father, being the positive person that he is, came out of it very well. And 6 months later, today he is able to walk very comfortably with the walker. His normal life is in no way affected. Whatever he used to do before, other than being able to go out normally, he's able to carry on. The biggest factor in that is just that he just will not give up. My sister and I and all our family, we are extremely thankful to the Manipal team, of course Dr. Kumar Dev and his team, the physiotherapy team, and everybody who's been amazingly supportive. Thank you.